Introduction. Diabetes is a chronic metabolic disorder that affects how the body processes glucose, sugar, resulting in high blood sugar levels. It is a significant health concern worldwide, and understanding the different types, causes, symptoms, and management of diabetes is crucial. This detailed note provides an overview of diabetes, its types, risk factors, symptoms, complications, and management strategies. Types of diabetes. A. Type 1 diabetes, also known as insulin-dependent diabetes or juvenile diabetes. Type 1 diabetes occurs when the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. People with type 1 diabetes require lifelong insulin therapy for survival. B. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes. It occurs when the body becomes resistant to the effects of insulin, or when the pancreas doesn't produce enough insulin to maintain normal blood sugar levels. This type is often associated with lifestyle factors such as obesity, sedentary lifestyle, and poor diet. It can be managed through lifestyle changes, oral medications, and in some cases, insulin therapy. C. Gestational diabetes. Gestational diabetes develops during pregnancy and affects women who did not have diabetes before pregnancy. It usually resolves after childbirth, but it increases the risk of type 2 diabetes later in life for both the mother and the child. Risk factors for diabetes. Several factors increase the risk of developing diabetes. A. Family history. Having a close family member with diabetes increases the risk. B. Obesity. Excess body weight, especially abdominal fat, is a significant risk factor for type 2 diabetes. C. Sedentary lifestyle. Lack of regular physical activity contributes to the development of type 2 diabetes. D. Unhealthy diet. A diet high in refined carbohydrates, sugary beverages, and unhealthy fats can increase the risk of type 2 diabetes. A. Age. The risk of developing diabetes increases with age, especially after 45 years. F. Ethnicity. Certain ethnic groups, including African Americans, Hispanics, Native Americans, and Asian Americans, have a higher risk of developing diabetes. Symptoms of diabetes. Common symptoms of diabetes include A. Frequent urination, increased urine production due to excess glucose in the bloodstream. B. Excessive thirst, increased fluid intake to compensate for fluid loss through frequent urination. C. Unexplained weight loss. Despite increased appetite, weight loss may occur due to the body's inability to utilize glucose for energy. D. Fatigue, feeling tired and lacking energy. A. Blurred vision. High blood sugar levels can affect the lenses in the eyes, causing blurred vision. F. Slow healing. Wounds, cuts, or infections take longer to heal. G. Tingling or numbness. Nerve damage, diabetic neuropathy, can cause tingling, numbness, or pain in the hands, feet, or legs. Complications of diabetes. Poorly managed or uncontrolled diabetes can lead to various complications. A. Cardiovascular diseases. Diabetes increases the risk of heart disease, stroke, high blood pressure, and other cardiovascular problems. B. Kidney damage, nephropathy. Diabetes can damage the kidneys, leading to kidney failure if left untreated. C. Eye problems, retinopathy. High blood sugar levels can damage the blood vessels in the retina, potentially causing vision loss or blindness. D. Nerve damage, neuropathy. Diabetes can damage nerves, leading to tingling, numbness, pain, and digestive problems. A. Foot complications. Poor circulation and nerve damage can increase the risk of foot ulcers, infections, and, in severe cases, amputation. F. Skin conditions. Diabetes can cause skin problems, such as fungal infections, bacterial infections, and slow wound healing. G. Pregnancy complications. Gestational diabetes increases the risk of complications during pregnancy, such as high blood pressure and preterm birth. Diabetes management. A. Healthy eating. Adopting a balanced diet that includes whole grains, lean proteins, fruits, vegetables, and healthy fats. Limiting the intake of sugary foods, processed carbohydrates, and saturated fats. B. Regular physical activity. Engaging in moderate intensity exercise for at least 150 minutes per week or as recommended by healthcare professionals. C. Medication. For type 1 diabetes, insulin therapy is essential. Type 2 diabetes can be managed with oral medications, non-insulin injectable medications, or insulin therapy, depending on individual needs. D. Blood sugar monitoring. Regularly checking blood sugar levels using a glucose meter helps in monitoring and managing diabetes effectively. A. Weight management. Achieving and maintaining a healthy weight through a combination of diet and physical activity. F. Stress management. Implementing stress reduction techniques, such as mindfulness, meditation, or engaging in hobbies, can help manage diabetes. G. Regular checkups. Regular visits to healthcare professionals for diabetes monitoring, screenings for complications, and adjustments to the treatment plan. H. Diabetes education. Attending diabetes education programs to learn about self-care, meal planning, medication management, and recognizing and managing symptoms. Conclusion. Diabetes is a chronic condition that requires lifelong management. Understanding the different types, risk factors, symptoms, complications, and management strategies is crucial for individuals with diabetes and those at risk. By adopting a healthy lifestyle, adhering to medical recommendations, and regularly monitoring blood sugar levels, individuals can effectively manage diabetes and reduce the risk of complications. It is important to work closely with healthcare professionals to develop an individualized diabetes management plan.